Today we'll be hearing from 4 advocates and researchers who will be sharing their work of advancing disability equity and also furthering gender equality. We're going to go into more depth into what this means as the panelists speak, into what challenges women with disabilities and gender diverse people with disabilities are experiencing, and also hearing about how we can support their work and their goals in order to further both aims. It's widely recognised that women with disabilities and gender diverse people with disabilities are often amongst the most marginalised in our community. Women with disabilities and gender diverse persons with disabilities experience systemic violations of their human rights based on their disability, on their gender, and or their sexuality and other intersecting identity. Note throughout this discussion, we'll be using the term gender diverse to include people with diverse sexual orientation, gender identity and expression, and sexual characteristics. People with disabilities comprise of around 16% of the global population, and they are women and men, boys and girls, non-binary, transgender. They are young and old, of all ethnicities and all circumstances. However, people with disabilities are disproportionately represented in every underserved group and vulnerable group. 1 in 5 women globally has a disability compared to 1 in 8 men globally. And in low and middle income countries, women are estimated to comprise of 3/4 of the people with disability. Women with disabilities face the same spectrum of human rights that a number of women without disabilities face, but social isolation and discrimination magnifies the experiences of injustice. The social structures and the power imbalances that perpetuate this exclusion marginalise both in all aspects of community life, including within disability rights spaces and also within women's movements and organisations. And we will certainly be hearing more about what needs to and can be done in both those spaces today. Currently in Australia, the Australian government released earlier this year their international development policy, under which it names 3 core areas of action. 1 is disability equity, and 1 is gender equality, the 3rd being climate change. And we very much welcome this articulation and commitment to these 3 areas. And as I'm sure many of you on the call today are also involved, that underneath this policy, there is 2 strategies being currently developed by the Australian government. 1 is the International Gender Equality Strategy, and the other is the International Disability Equity and Rights Strategy. And today we'll be hearing from 4 speakers who work, live, and experience living at that intersection of gender equality and disability equity, and the call for the human rights of women with disabilities and gender diverse people with disabilities at the intersection of both those areas. So with that introduction, I would like to take the opportunity to invite our first speaker to the floor. We are very fortunate today to have Janie Mejias join us. Janie is a US organizer and a lead researcher at Women Enabled International. She is responsible for coordinating Women Enabled International's US focused project, and also the co-author of the global resource Strengthening Gender Inclusion in Disability Spaces. As a lifelong wheelchair user, Janie is very active in the disability rights community. She has a PhD in disability studies, as well as a recipient of numerous awards and fellowships in recognition of her work. Thank you, Janie, very much for joining us. I pass the floor to you.
Thank you for having me. I'll give a short description of myself. I am a woman with brown hair. I am white and Hispanic. I have my hair up in a bun today, and I'm wearing glasses. I have on a magenta colored sweater, and I'm sitting in my home office, which doubles as my guest bedroom. So thank you all for coming today, and I look forward to sharing my work with you. I am the U.S. organizer for Women Enabled International. Women Enabled International is a U.S.-based nonprofit organization that works to advance the rights of people living at the intersection of gender and disability worldwide. We do a wide variety of work, focusing mainly on capacity strengthening of advocates with disabilities who are living at the intersection of gender and disability, and working with organizations that work at our intersection. We strive to hold human rights actors accountable and do a lot of advocacy work at the UN, as well as the inter-American system. We also have a number of movement building initiatives, one of which is the US Gender and Disability Justice Alliance, which I coordinate. Another one is the Latin American Collective, and third is the Inclusive Generation Equality Collective. And all of these collectives and alliances work to amplify the voices of women and gender diverse people with disabilities in their respective regions. Today, I'm here to talk to you about a toolkit that I authored with Susanna Phillips, the Director of Strategy at WEI. And the toolkit is entitled A Resource Guide for Strengthening Gender Inclusion and Disability Rights Spaces. And it aims to ensure that women and gender diverse people are included in disability rights spaces and have opportunities to lead these spaces. It was noted that this research needed to be undertaken because of the persistent gap in gender inclusion in disability rights spaces throughout the world. Women with disabilities and gender diverse people are often not in positions of leadership within these spaces. So we undertook this research to fill this gap and learn more about the barriers and facilitators women and gender diverse people face in disability rights spaces. In the spring of 2022, we conducted 4 focus groups with women and gender diverse people who advocate at the intersection of gender and disability rights. This project was supported by the Disability Rights Fund and the Disability Advocacy Fund, and we are grateful for their support. The focus groups included individuals with a wide variety of disabilities and backgrounds. The focus groups were divided into the following categories: women with disabilities from Africa, women with disabilities from Asia, women with disabilities from the Pacific, and advocates with disabilities with diverse sexual orientation, gender identity, expression, or sex characteristics from across the globe, also known as diverse SOGIESC. There was a total of 21 participants that took part in this project. Advocates that we spoke with identified a number of barriers to their inclusion in disability rights spaces. The first was lacking opportunities for education and capacity strengthening. In many regions, the graduation rate of women with disabilities is very low. Women and gender diverse people in these regions often lack the self-esteem needed to initiate involvement in the disability rights movement. Second, entrenched patriarchy was a barrier. In many regions, the disability rights movement is led by older men who are unwilling to change their persistent beliefs that women and gender diverse people are less capable than men. And as such, issues that are important to women and gender diverse people with disabilities were deprioritized. Next, participants identified social taboos as a barrier. Women and gender diverse people with disabilities are often shy to talk about sex and sexuality, which inhibits their involvement in disability rights spaces. Information about sexual and reproductive health is rarely made available in accessible formats, which compounded these barriers. And the advocates we spoke with also talked about discrimination on the basis of sexuality and gender identity, both in laws and practice. This limited participation by gender diverse people in disability rights spaces. And some countries have laws prohibiting homosexuality and gender diversity. And in some cases, there are penalties for even discussing issues related to homosexuality and gender diversity. And this really inhibited ability to participate in disability rights spaces, even though many advocates we spoke with said that privately, leaders within disability rights spaces would tell them that they supported them, but because of the law, they could not let them actively participate. Also, attitudinal barriers of personal assistants and parents responsible for helping their gender diverse child dress was also mentioned as a barrier. Because sometimes the people responsible for helping with dressing weren't supportive of helping the person dress in a gender affirming way, in a way that made them feel comfortable in public spaces, and including disability rights spaces. The silotization of funding was also a barrier. There was very little funding available at the intersection of gender and disability, which made it very difficult to further projects focusing on this. There was also a variety of facilitators, despite the barriers that participants spoke of. These included coalition building, so smaller organizations forming coalitions with bigger organizations, sometimes organizations that may not focus on gender, but are willing to join in solidarity with smaller organizations that are focusing on gender and disability to amplify voice. And we heard a lot that was successful. Also, strengthening the capacity of leadership abilities of women, girls, and gender diverse people with disabilities to exercise agency. An example of that would be the initiative being done by Advocacy for Women with Disabilities Initiative in Nigeria. And this initiative is being undertaken by the Nigerian Women's Trust. They held a capacity strengthening workshop for women with and without disabilities. The workshop emphasized the importance of self-help groups for the purposes of both empowering persons with disabilities at the grassroots level and providing reliable data. This workshop resulted in the expansion of the self-help network to 88 groups as of February 2023. The disability justice framework is also important for amplifying the leadership of women and gender diverse people with disabilities. This framework is primarily being used in North America, and it works to center the voices of multi-marginalized people with disabilities, including Black and Indigenous people with disabilities and people with disabilities with diverse SOGIESC. Within this framework, multi-marginalized people are leading the work, oftentimes from the beginning. This is primarily being used in North America, but could be adapted and used internationally. Next, strengthening the capacity of mainstream disability actors and funders to be gender inclusive. Examples of this included the Disability Rights Fund training on gender inclusion. They require all their project fundees to undergo gender inclusion training. And we heard from many participants that this was extremely helpful to their organizations. Also, disaggregated data was extremely important for funders. And example of this would be integrated disabled women's activities in Uganda is collecting data forms which gives information on women with disabilities and girls who are seeking sexual and reproductive health services from health centers across the Kamlio district in eastern Uganda. And then gender inclusive budgeting is really important. We heard this a lot from participants, specifically from participants in the Pacific. And gender responsive budgeting responds to the needs of a gender diverse population, which includes women, men, non-binary people, and other gender diverse people with disabilities. Recently, the Spotlight Initiative has sponsored a number of workshops on gender inclusive budgeting in the Pacific region. CSOs, including women-led organizations and other organizations of persons with disabilities, have been participating in this workshop to strengthen their capacity to develop gender responsive budgeting for their own organization and to support the government to similarly strengthen gender responsive budgeting processes. Lastly, increasing access to technology was also identified as a facilitator. An example of this would be the Disability Trust Skills Program. This is a platform that provides accessible learning materials digitally. Members can learn about digital literacy, storytelling techniques. There's a mental health curriculum for providers. Sunny was also identified as an important component. digitally, and this is from Women with Disabilities Australia. It provides easy read material on gender-based violence, who to contact for help, and your rights as women and gender diverse people. Users can also share their story through the app. Sex E Limu is an app that provides sexual and reproductive health information in Kenyan Sign Language. The resource guide also provides a number of cross-cutting recommendations. And I think, can I have a time check? I think I might be over the time, so I just want to check.
Hi, Janie, it's Kerryn here. Yes, just one more minute, if you wouldn't mind wrapping up.
Okay, yeah. So I will just note that the resource guide provides a plethora of recommendations for a variety of disability rights actors, such as funders, OPDs, international disability rights spaces, and intergovernmental disability rights spaces, as well as the media. And this toolkit is available on our WEI's website. If you go to womenenabled.org, you can read the recommendations and the whole resource guide. So I'll leave it at that.
Thank you very much, Janie. And I will share the link to the guide with everyone in an email following this webinar as well, to be able to link into it. So thank you very much, Janie, for giving us that snapshot from really important research. And I'd certainly encourage you to, everyone on the call, to read the research and to look at the toolkit as well, which we'll send through after. And it's now my pleasure to welcome our second speaker. So thank you very much, Eve, for joining us today. Eve Naqio is the project lead at the Disability Pride Hub in Fiji. And she's an advocate for Pacific Islanders as gender diverse people with disabilities. They're based in Fiji and over the years now include members from all around the region. They operate with the support of Disability Rights Fund and the Rainbow Pride Foundation. Their mission is to increase the visibility and networking among people of diverse SOGIEC with disabilities by fostering inclusion and dignity in diversity of members in their intersection. Welcome, Eve. If you'd like to put your camera on now. And we welcome Gail as well, who will be voicing and signing for Eve.
Just a question, are you able to see me?
Yes, thanks, Gail. It's Kerryn here. We can see you. We just need to unmute you so we can hear Gail.
No, actually, that was Eve asking. Can you see?
Yes, Eve, I can see you. Thank you.
Sure, I'm unmuted. I'm speaking from my laptop. Bola Vinaka. First of all, I'd like to introduce myself again, very briefly. I'm Eve Naqio, and I hail from Lovoni, Ovalau. That is where the old capital of Fiji is. I'm 36 years old, and I have a son who is 11 months, an adopted son. I identify as her and she, and I am the project lead at the Disability Pride Hub. My background, okay, right now I have a Fijian afro. My hair is black, it's fizzy. I have very light lipstick on, lip gloss. I'm wearing a Fiji National University t-shirt because I've just done some work with them. And there's a blue wall behind me. The Disability Pride Hub was first established in 2019 with just a few like-minded friends with common goals who got together and drew a map of our visions and objectives. In 2021, we were an organization, and with the support of the Disability Rights Fund, part of our project was to work on our registrations and to develop organizational policies. We are the first LGBTIQ with disabilities organization in the Pacific region, and we are slowly growing in numbers, both locally and regionally, with the hope that in the near future, either we will have a coalition partnership or that we will have a coalition partnership. Also, I'd like to acknowledge the fact that since establishing DPH, some members have become aware of our rights and the services provided. And this has boosted the morale of some to come out. It is a work in progress. The cultural aspects play a huge role in how a member is accepted in the families and communities. This leads me to talk about the challenges. The struggles are real, and I feel they need to be shared so that we have development partners, government agencies, the communities, as well as families to work together to build an inclusive community free of discrimination and inequality. Our Pacific culture plays a significant role in shaping our communities. Whilst we respect this, we also have to maneuver our strategies in such a way that we can progressively build on an understanding and awareness where they matter. Some of our members drop out of school because priority is given to our siblings, and we are seen as someone to be taken lightly, and that we can either do tokenistic jobs like wiping tables in restaurants, or stay home and clean the house and fetch food from the sea or the farms. There are some difficulties we go through as having multiple identities. Trying to access health services, getting tested for HIV, for instance, since there has been no or little education on sexual reproductive health and rights, the lack of communication, language barriers, and fear of being ridiculed in the village is a drawback that can leave some members suffering in silence without counseling or having a mentor who can encourage them and make referrals to service providers. We have actually had a member who was diagnosed with HIV and was going for checkups. But because he sometimes found it more convenient to go without an interpreter, the communication was somehow lost, and this led to his condition to become worse and lead to his demise. We've witnessed firsthand how mentally distressing this could be. And there were a lot of challenges that this dear friend had. I'd like to share about another member who is a diabetic, and because he thought he would be a burden to his family, who was barely surviving, he decided to keep it to himself until one day He was rushed to the hospital when he fainted, and the diagnosis was relayed to his family. A lot of thoughts run in our minds because of how we are treated. It contributes to how we react to our situations and conditions, whether it be in areas of education, employment, health, accessing services, or just being part of the community. Mental health is extremely important. Imagine a deaf person who has been thinking about his sexual identity and orientation since childhood. The lack of understanding and support from home. This will deeply affect his or her performance in school and his inclusion in the community. The mainstream Rainbow Pride community have their own shares of issues and barriers. And you can only imagine how some of us will have to repeatedly come out in a range of ways, in layered processes that our needs and services are met by the providers with a huge focus on those that we interact with on a daily basis that includes our communities and families. Some programs that DPH engage in to support our members is, first of all, an awareness program where members are educated about the Convention on the Rights of Persons with Disabilities, the human rights, our Constitution, and autonomy, as well as we have a few peers who can provide the support or listening ear before making referrals for further support. We are an organization with diverse SOGIESC identities and diverse disabilities, so we ensure that the full range of diverse needs and services are met. We also piggyback on other activities so we can talk about our issues and create visibility about our existence. These programs impact our members by opening their mindsets and building confidence to come out. Like watchdogs, we keep a track of the works of our government, the policymakers and development partners, and we put pressure on those stakeholders to raise our advocacy and implementation plans. This is done collaboratively with our umbrella organization, the Rainbow Pride Foundation, or the Fiji Disabled People's Federation. As a collective, we would like to suggest that the development partners implement strategies and provide technical assistance so that our policies are actually inclusive and there are accessible services specifically to our needs as SOGIESC with disabilities. And these can be achieved in part through policies and practices that actively respond to that. And these must be prioritized to support the SOGIESC with disabilities community so we are not left behind. Thank you once again for giving me this opportunity to speak in this panel. I'd be happy to answer queries on question time. Vinaka Vakalevo. Thank you.
Thank you, Eve. It's Kerryn speaking here. Thank you, Eve, so much for joining us and sharing the work of the Disability Pride Hub and also the many challenges that gender diverse people with disabilities throughout the Pacific are facing. It is inspiring to hear the work that you and your colleagues are doing in this space, and we look forward to hearing more as your organisation grows as well. It's my pleasure to introduce our third speaker, Maria Un. So welcome, Maria, and thank you very much for joining us today as well. Maria is the chair of the South Sulawesi branch of the Indonesian Association of Women with Disabilities, also known as HWDI. Maria is a disability rights activist with over 14 years of experience working with organisation of people with disabilities and promoting the rights of Indigenous women with disabilities specifically. We look forward to hearing from you, Maria, today, and for particularly hearing about your work, sharing the work and the research that you have conducted speaking with Indigenous women with disabilities, particularly with a focus on climate justice. So thank you, Maria.
Thank you very much, Kerryn. Good morning, everyone. Thank you for having me in this great webinar. My name is Maria Un. I am 61 years old, and I have brown skin with curly hair and wearing glasses. And today, I am wearing orange batik blouse and also orange hijab. And I have a light yellow wall behind me. Next, Kerryn. Thank you. HWDI is focusing in advocacy, gender equality, empowering women with disabilities, and assistance to women and girls with disabilities, victims of gender-based violence, especially sexual violence. Currently, by the support from DRF, we are working to empowering Indigenous persons with disabilities, especially women, so that they are able to participate in decision-making processes in local level development. And today, I am going to share our current research at intersection of climate change, gender equality, and indigeneity. I will explain about why it is important to look at the intersection between climate change, Indigenous peoples, and disabilities, the results of the research, and what we would recommend in the future regarding this issue. We all agree that humans rely heavily on land, water, temperature, air, biodiversity, and healthy ecosystems to ensure their survival and existence. And this is also applies to people with disabilities from the Cenreanging and Sandobatu indigenous community, two of indigenous community in Sidrap district, South Sulawesi province, Indonesia. Extreme weather change will affect the lives of indigenous peoples, especially those who live in ecosystem areas that are most vulnerable to climate change, such as small islands, coastal areas, and tropical forests. The real impact of climate change is felt when indigenous communities are facing the planting and harvest seasons. Climate change also has an impact on the condition and status of forests throughout the world, including in Indonesia. Drought with hot temperatures can contribute to a greater number of tree deaths, while many communities, including indigenous communities, still rely on managing forest products for their daily lives. South Sulawesi itself has a very big forest area, almost 2 million hectares. Likewise, that forest area in Sidrap district is around 68,000 hectares. And Sidrap also is included in a vulnerable area to climate change in South Sulawesi province, where the potential for extreme weather has a hazard status from moderate to high and has a high vulnerability. This is based on the hazard and vulnerability map document for South Sulawesi province year 2022 to 2026. Indigenous peoples with disabilities are relatively small group. That takes forest products and emits greenhouse gases into the air. but must bear the heavy burden of the current climate situation. Climate change also has the potential for individuals and groups with disabilities to fall into poverty. However, Indigenous people with disabilities is a group that is still neglected in various forms of substantive participation in natural resource management. They are also neglected in various efforts to adapt to the negative impacts of climate change in environmental development schemes. And in Indonesia, in relation to the participation of persons with disabilities in natural resources issues and climate change, especially in villages as administrative areas where indigenous communities live, it is very difficult to find data and information about natural resources management policies that mention participation of persons with disabilities. Next. These research participants are individuals and also groups of indigenous persons with disabilities from two communities as mentioned above. The result of this research, among others, 1. Gardening, farming, animal husbandry, and forest plant sales services are the main livelihoods for women and indigenous groups with disabilities in Cendeanging and Sandobatu community. Indigenous women with disabilities and indigenous groups with disabilities in Cendeanging and Sandobatu community are experiencing various challenges due to the negative impacts of climate change. The education status of indigenous women with disabilities has not completed elementary school and also has never received yet any informal education, including about all related with climate change. However, they have very good social interaction within the main family and close neighbors, including indigenous women with disabilities, not yet or do not have independent capital and have never received capital assistance, seeds, and fertilizer either from customary institution or their village government. And there has been no special involvement in participation and management of natural resources, and there have been no efforts to anticipate the negative impacts of climate change for indigenous women with disabilities and indigenous groups with disabilities, both at customary institutional and village government levels. Also, currently, there is no specific policy that regulates participation and management of natural resources, as well as climate change anticipation policies for indigenous women with disabilities, as well as indigenous groups with disabilities. Likewise, there are no special institution or structure that manage participation and management of natural resources, and there are no special institution to anticipate the negative impact of climate change for women with disabilities and indigenous group with disabilities, both at customary institutional and village government. Indigenous women with disabilities respond to livelihood obstacles due to the negative impacts of climate change by carrying out adaptive work in the form of selling dishwashing services at wedding party and carrying the rice harvest. Likewise, there are also those who make a living by running a sewing business. Some important recommendations in the future regarding this is: 1, customary institutions must have written policies that regulate the management of natural resources for indigenous people with disabilities. 2nd, village institutions with the authority to make policies must have village regulation that regulate the participation of indigenous people with disabilities in village development. This must regulate also this group to access to economic, environmental, and other programs, including special village meeting for persons with disabilities. Next, in the policy-making process, whether related to various efforts to anticipate the negative impacts of climate change or other developments at CDRAP district levels, village levels, and customary institutions must significantly involve women and men with disabilities at all stages. The initial step that needs to be taken by the CDRAP district government and village institution is to collect data on indigenous persons with disabilities, especially who lives in the 2 communities and 4 villages in the research area. This data must cover all types of disabilities, including children. Next, government at all levels, starting from the national level, provincial level, district level, sub-district level, and village level, need to take concrete steps to provide access to get informal education related to livelihoods and the impact of climate change for indigenous women with disabilities. And the last, donors to support initiatives taken by DPOs to encourage meaningful participation of persons with disabilities related to climate change, gender equality, and indigeneity. I thank you very much. And thank you also to ADDC for this great webinar. Thank you very much.
Thank you, Maria. It is Kerryn speaking again. Thank you again for joining us and sharing the research and that very clear and actionable list of recommendations, which I will also share with those participants here today in the webinar after we've finished as well, so you can go through them as well and look to incorporate some into your work. Our last speaker today gives me the pleasure of introducing Kathryn. Hi, Kathryn, and thanks very much for joining us. Kathryn James is an independent consultant focused on disability inclusion and gender empowerment. She has recently authored a piece of research with CBM Australia's policy and advocacy team on the need for greater inclusion of women with disabilities in gender programming and women's movements. So I will pass the floor to you. Thank you, Kathryn.
Thank you so much, Kerryn. I'm a white woman with blonde hair to my shoulders, with a flowered shirt sitting in my living room. Now, I know we're running short on time after all those amazing speakers, so I'll just speak really briefly. But as Kerryn mentioned, I've recently conducted some desk research and interviews for the CBM Australia policy and advocacy team. And this looked at whether and how mainstream gender programs include women with disabilities and address the needs and rights of women and girls with disabilities, including those who are gender diverse. And the resulting paper is called Missing Voices. It's released this week, so this will just give a taster, but you can definitely look for that. I think it'll be circulated after the webinar. And so I know Janie spoke about how the research she was involved in highlighted the gap in disability rights spaces and barriers faced there. And what this research highlighted was that there's certainly examples of good practice and examples of inclusion, but there were multiple examples found of recent programs, including DFAT-funded mainstream gender programs, that really fell short in terms of inclusion of women and girls with disabilities. So some of the issues that were identified was that there was limited consideration of the rights or priorities of women and girls with disabilities in programs, inadequate engagement with women with disabilities and their representative organisations, poor progress on disability inclusion, and then OPDs also reported barriers such as that reasonable accommodation wasn't funded by some organisations, so they were invited or expected to be involved, but accessible transport wasn't provided, or per diems weren't provided. And this was seen across programs, including some of DFAT's flagship gender programs like Investing in Women, as well as programs that were being implemented by Australian NGOs. I would emphasise that this is a snapshot, and this highlights some issues within programs. There was definitely varied results, but it is really concerning to see that in very recent programs that we're still not seeing a strong focus on women and girls with disabilities, even though we know that women and girls with disabilities are more at risk of violence, that they lack economic opportunities, have very low representation in leadership spaces, and these are a lot of the issues that many gender programs are trying to address. Other findings were also that evaluations sometimes failed to actually disaggregate data by disability or look at are there differing outcomes for women with disabilities, and that some of the tools that were used by gender tools that had been developed for mainstream use didn't necessarily meet the needs of women with disabilities. For example, power dynamics within households meant that tools weren't safe or appropriate for women with disabilities to use. The other aspect that the report looked at was also inclusion in mainstream women movements and organisations across Asia and the Pacific, and consistently OPDs across countries including Indonesia, Bangladesh and Timor-Leste reported they didn't feel these movements adequately represented the interests or the human rights of diverse women with disabilities. OPD representatives often did not feel welcome in women's rights spaces, and yet they also felt that organisations didn't understand human rights issues facing women with disabilities. And a common issue was that the very serious human rights issues that face women with disabilities were not necessarily perceived as women's rights issues, but rather as disability issues that should be being dealt with by the disability movement, not as fundamental to gender justice. And an example was given by an Indonesian representative of an OPD for women with psychosocial disabilities, who was raising issues of institutionalization, forced sterilization, sexual violence against women with psychosocial disabilities. So very, very serious human rights abuses, but these weren't being recognized by mainstream organizations as women's rights issues. So the paper includes recommendations to help strengthen and improve representation and inclusion. Some of these include fostering and the formation and growth of OPDs that represent diverse women with disabilities, and that this includes funding, creating core funding rather than just program funding, but also ensuring that there is specific expertise on disability within gender programming. So engagement with OPDs is vital, but that's not an excuse to not also embed expertise and employ women with disabilities within programs. In terms of women's rights movements, there was a real need to build an understanding of the social norms and barriers that women with disabilities face, and also to promote that understanding that rights issues for women with disabilities are a vital component of gender justice. So the report is Missing Voices, that will be out this week. And I encourage you to look at it, but I think it really highlights gaps that we're still seeing in development programs within the mainstream gender space. I'll leave it there.
Thanks, Kathryn. This is Kerryn speaking again. And On that note, I don't think I need to do much wrapping up. I note that we are on time, so apologies we have not had time for a question and answer session. However, I do want to thank our 4 speakers very much for coming today and for bringing to our attention a number of the core issues that women with disabilities and gender diverse people with disabilities across our region are experiencing, and the work that is going currently to be able to address the human rights abuses and to advance gender equality and disability equity, and those who are living at that intersection of both. We will share the research and resources that have been mentioned throughout today's session with you after the webinar, as well as links on how we encourage you to mark International Day. So you will see on our final slide up on the screen an invitation to participate in activities around International Day, which is on the 3rd of December. You can do it the lead up to or just after. And I will also share these in an email, including sharing this recording, which we will share, sign our petition calling for the Australian government to develop an ambitious disability equity and rights strategy for your international development program and broader work. Share CBM's fantastic series for International Day, profiling the voices of people with disabilities. We also have a toolkit with many more ideas, which I will send a link to in the email. So thank you again, everyone, for joining. It has been a fantastic session, and a special thank you to our speakers, our interpreters, and our live captioner as well. I hope you all have a fantastic rest of the day. Thank you.